Hi, I'm Dr. Jonathan Chung. I'm an upper cervical chiropractor and the board-certified chiropractic neurologist, and today we're going to be reviewing two neck strengthening devices. First, we're going to be talking about the Neckslevel cervical strengthening device, and we'll be talking about the Iron Neck. Talk about the Neckslevel device. So this is the Neckslevel. It is a strengthening device developed by a physiotherapist. Basically, it uses a slider mechanism, and where you can use these different resistance bands to change how strong you want the resistance to effectively build some strength in the neck. So here's our wall-mounted setup. We put on a headband that has a little bit of a friction pad on the back of it, and then we actually set our resistance on the device, and that's going to help us add some resistance when we try to turn our head against the sliding mechanism. And the sliding mechanism makes it super easy. It makes the neck movement super smooth. It's great when patients have neck pain or some neck instability issues to help guide and facilitate movement easier. The device has a little bit of variability, so you can do some lateral flexion. You could also turn the headband around and place your head forward onto the device and slide the head going forward to giving you a slightly different type of stimulus. And you can put the device on the ground if you want to do some flexion and extension type movements. Many of you guys may be familiar with this, and you've seen the Instagram ads for it. It's called the Iron Neck. It's basically a halo that you can place right on top of the head. And then on top of the device, you're going to have a little bit of an anchor point, so you could attach a resistance band like you might see inside of a gym. You hang this onto an anchor point, either on a wall or a rig of some sort, and then you can start to do the training that way. So the best thing about the Iron Neck is that you could set it up in a variety of different positions, and you could make the weight and resistance pretty customizable depending on what type of resistance band you want to use. So these are some examples of doing some lateral flexion exercises. You could do protraction, retraction, some rotation, and probably the best thing is you could do these multi-planar movements and putting your head through some figure eight or circular types of patterns, which provide a nice and dynamic stimulus to the neck. Pros of the Neckslevel: it's really easy to use. It actually feels really good to slide your neck from side to side and laterally bend with this slider. And it's easy to progressively load with the different resistance bands, and it can still be quite challenging. Cons: they're probably a little bit limited in what types of movements that you can do compared to the Iron Neck. And the cost is going to be a bit more expensive, with the basic unit being about $300 and the clinic setup being about $1,000. Pros of the Iron Neck is you could use it at any facility and use it at any place, so there's a lot of dynamic to it. You could do a lot of different dynamic movements, applying resistance at a lot of different types of patterns, which is useful for combat sports. And you can load it as heavy as you can want with any type of resistance band that's available to you. Cons of the Iron Neck is for patients that have neck pain or some type of instability, having that wider range of motion isn't always going to be a good thing initially, and there is a little bit of a learning curve. For a clinical population, I think the patient experience has been better with the Neckslevel just because of the smoothness of the movement, and many patients report feeling really good while they're actually going through the exercises and the training, or sometimes the Iron Neck can actually feel a little bit clunky when you're first starting to learn how to use it. Now, for athletic populations, the Iron Neck may win out because neck exercises, quite frankly, are a little bit boring or monotonous. So the ability to combine neck training with other exercises like rows or this bow and arrow exercise, or even seeing people doing squats and bicep curls while adding some neck tension, can be a way for you to get a neck stimulus while you're doing other exercises. So if money is no object, then you can play around with both if you'd like. But if I were to just pick one, then my vote would be Neckslevel, just because I work with this clinical population with craniocervical instability and herniated discs. And for just generalized strength training of the neck, I think it covers all of your bases. But let me know what you think in the comments. And if you think there's another device out there that I should check out, then post that in the comments below too.